Uh, my dear student, I am welcome you all to my channel. This class I am going to discuss with you from the continuation from the dental product. So this class I am going to discuss with you about fumes and desensitizer. So what is mean by fumes? So fumes is mainly originating from volcanic. Why? Because it plays a major role for the dental product. Why? Because it contains complex silicate of like aluminum, potassium and sodium, so it is to be used as a abrasive. So it's very useful for the dental product. So let's see one by one. So how they are preparing fumes from volcanic origin. It is a substance of volcanic origin produced when lava with a very high content of water and gases is thrown out of the volcano. As the gas bubbles escape from the lava, it becomes frothy. So when this lava cools and hardens, so some of the gas bubbles escaping from the lava, so it becomes frothy. When this lava cools and hardens, it results in a very light rock material filled with tiny bubbles of gas. It consists of mainly of complex silicates of aluminum, potassium and sodium. So it is very light, hard, rough, porous, grayish mass. So it is odorless and stable in air. So it is used as an abrasive. So it's so that we are preparing fumes from volcanic origin because of it contains lot of silicates of aluminum in the form of silicates of aluminum silicates or in the form of potassium silicates or sodium silicate. So these three types of silicates to be used as an abrasive. In the previous session I already discussing with you about abrasive. Abrasive is not recommended by our own medication, but it's a dentist is recommended to you. Then it is used for polishing and cleansing purpose. So finally ground fumes is added to some toothpaste and hand cleaner as a mild abrasive. Next we'll see about desensitizer. So desensitizer is nothing but the name indicates you or gives you an information about which will sensitize the teeth or it will decrease the sensitization. So the desensitizers tend to decrease hypersensitivity of the teeth when applied to their outer surface, especially where erosion has occurred near the gum line, which I already discussed with you in the first class. We have three layer. First one dentin, the teeth has three layer. First layer become dentin, second one is enamel and third one is cementum. So if the first layer like dentin is somehow somehow has some has damaged or by erosion occurs on the first layer, thereby we will have feel about while drinking any hot coffee or tea or uh, hot meals if you are taking, so you will have pain on the teeth or tooth. So it can be treated by using desensitizer. Like desensitizer here plays a major role to decrease hypersensitivity of the teeth. So where erosion has occurred near the gum line, they reduce the sensitivity of the teeth to heat and cold. So inorganic compounds of desensitizers are especially strontium chloride and zinc chloride. So these two chloride in the form of strontium or zinc plays a major role. It acts as a desensitizer. So now let's see one by one. So what is the formula for zinc chloride? Zn and molecular weight 136.28. Then what is the synonym for zinc chloride? Butter of zinc. So it contains not less than 95% and not more than 100.5% of zinc chloride. So method of now we will see about how to prepare the zinc chloride. When zinc to be treated with hydrochloric acid, there is a formation of zinc chloride and removal of hydrogen. So it is prepared by heating granulated zinc. That means not normal zinc, that granulated zinc with hydrochloric acid. When evaporation of hydrogen ceases, so the solution is filtered and evaporated to dryness. So properties we'll see. It occurs as a white, odorless, deliquescent crystalline powder or granules or opaque white mosses or sticks. So 1 in 10 solution of acid to litmus and pH about 4. It is soluble in water, alcohol and glycerol, freely soluble in acetone. Usually its solution in water or in alcohol is slightly turbid due to the formation of zinc oxychloride. So usually if you are going to dissolve with either water or alcohol, it gives you like a turbid coloration. With that turbid, you know already, being a first year student, you will perform in the limit test for chloride or sulfate. You know the turbid means somewhat cloudy nature, not like curd or not like buttermilk, somehow cloudy, somehow precipitate like that. That is known as turbid. So due to the formation of zinc oxychloride. Why? Because when zinc when react with with water or in alcohol, so it produces the zinc to zinc oxychloride, that will give you turbid coloration. So but the turbidity disappears with little addition of hydrochloride. So first of all, first if you are going to treat with water or alcohol, first to produce the zinc oxychloride, thereafter from zinc oxychloride to, while we are adding hydrochloric acid in that, it is converted into zinc chloride. There is at the same time the evaluation of hydrogen also occurs. So this is the reaction and properties all of the about zinc chloride. Next we'll see about uses. So I already told you it is to be used as a abrasive. Anyway, it is used as a antiseptic, astringent to the skin and mucous membrane as a 0.5 to 0.2% solution. It is used as an active ingredient to prepare magnesia cements for dental fillings and certain mouthwashes. So it is one of the active ingredient for the preparation of dental filling and certain mouthwashes. It is also used as a dentin desensitizer. Dentin is first layer, I already told you, dentin desensitizer. So topically as a 10% solution of the teeth. That means topically means on application of external. I already told you topical is differ from oral. Topically as a 10% solution of teeth. Next we'll see about strontium chloride. So these two inorganic, pharmaceutical inorganic substance to be used as a antiseptic, astringent, and also may also used as a some of dental filling and certain for the main active ingredient for the mouthwash also. Next we'll see about strontium chloride. Here, what is the molecular formula for strontium chloride? SrCl2, or this is anhydrous and hydrous formation. So wherever we have the molecules of water, so it is known as hydrous, and without water molecule anhydrous strontium chloride. Here strontium chloride with 6 molecules of water. Property, it is occurs as a colorless, odorless crystals or white granules. It efflorescence in air. It is a deliquescent in moist air. It is soluble in water and alcohol. So it is used as a toothpaste for the relief of dental hypersensitivity. So chloride in the form of strontium or zinc chloride mainly used as a desensitizer purpose. Then next we'll see about zinc eugenol cement. So there is a formulation in two formulations available in that, liquid or another one is powder formation. So in that liquid, eugenol react with zinc oxide, and here olive oil to be there, and here olive oil act as a plasticizer, and in that powder formulation we have zinc oxide, that is the principal ingredient, and zinc stearate, that is a plasticizer or accelerator, and zinc acetate also accelerator and improve strength, and white rosin to reduce the brittleness of set cement. So these are the purpose mainly. So for forming artificial cement, artificial teeth construction. So these type of like eugenol, zinc eugenol cement to be used for artificial setting of teeth. So here we'll see about the properties. It is a cement of low strength, so low abrasive resistant and low flow after setting. So it is used for temporary filling, not be more than few days. So it has adhesive effect on exposed dentin. It is least irritating than other dental cements. So it is used as a impression material during construction of complete dentures, and is used in the mucostatic technique of taking impression. That means nothing but it is used on impression material during construction of complete denture is nothing but it is mainly used for setting for the formation of artificial setting for the teeth, and also some mucostatic technique making of the taking impression. Next we'll see about overall. So far I think overall will give a complete solution about dental product. Now we'll see the review questions. So this will help you somehow the definition about what are the saline features, that the previous classes also. First session I already discussed with you what are the saline features. So anyway, this review questions will give you much more understand about dental product. So define dentifrices. So a dentifrice is a substance used with a toothbrush for the purpose of cleaning the accessible surface of the teeth. I already told you dentifrices available in the form of either paste or powder. Tooth powder or in the market might be available tooth powder or toothpaste. It's nothing but cleaning our teeth with the help of finger or with the help of brush. Is nothing but it's a medical term for cleaning our teeth or tooth. That is nothing but dentifrices. And next one, define dental caries. So dental caries is nothing but it's a medical term for dental caries. You may say tooth decay or cavities. Those dental caries is the medical term for tooth decay or cavity. So now I already discussed with you what are the anti-caries, that is anti-cariogenic agent to prevent you from these dental caries. For example, role of fluoride and role of phosphate plays a major role to prevent you caries from the prevent you from the dental caries. Then next we'll see about what is the role of fluoride. Fluoride removes the anti-caries as it replaces this is the mechanism of action, how it act on our teeth. So it replaces the hydroxyl ion in hydroxyapatite. That means here the hydroxyapatite, when we are going to treat with the sodium fluoride, that replace the hydroxyapatite, thereby replace the fluoride ion which form fluoroapatite. This is the main mechanism of action of role of fluoride, and also main use of this fluoride. It is preventive from dental caries. Next question, does the desensitizer increase or decrease the hypersensitivity of the teeth? Obviously, we know it which will that desensitizer which will decrease the hypersensitivity of the teeth. So desensitize tend to decrease the hypersensitivity of teeth. Next, what is the molecular formula of dicalcium phosphate? So these are we already discussed in the previous session. Calcium in the form of calcium carbonate, calcium sulfate and calcium chloride, and dicalcium phosphate. These are comes under cleaning purpose. So these are the main ingredient to be added in the tooth powder or toothpaste for cleaning purpose. So here, what is the formula for dicalcium phosphate? CaHPO4. Next we'll see, name any two inorganic compounds which are used as dental caries. So two inorganic compounds, two inorganic, here the role of phosphate also used here. Role of phosphate and role of fluoride plays a major role to prevent you from dental caries. I already discussing now also the few minutes also I discussing with you role of fluoride, like sodium fluoride and stannous fluoride. Here the two inorganic substance to be used for the preventive from dental caries, like role of phosphate in the form of sodium monohydrogen phosphate and sodium dihydrogen phosphate, also main two inorganic pharmaceutical inorganic substance used to that means preventive from dental caries. Next we'll see what is the another name of sodium metaphosphate. Sodium metaphosphate is also known as Mandrella salt, or otherwise simply we may say synonym of Mandrella. Synonym for sodium metaphosphate is nothing but Mandrell's salt. Then how is stannous fluoride prepared? When stannous fluoride to be treated with hydrofluoric acid, is conversion of stannous fluoride, there is a removal of water molecule. That stannous fluoride is prepared by heating stannous oxide with gases. So these two ingredients to be that when stannous oxide heating with hydrogen gaseous hydrofluoric acid, so the formation of stannous fluoride and removal of water, that is a preparation for stannous fluoride. Next we will see about how can dental caries be prevented. So dental caries can be prevented by using dentrifiers. Dental caries mean it's like a sticky layer which will deposit on the teeth while after eating food or after taking after drinking tea or coffee. We should immediately gargle with water, or otherwise if any foodstuff to be present in between the gap of the teeth or tooth, that will secrete the acid. Each formula may it secrete the acid solution, thereby with the help of our saliva it's make it's like sticky formation on the teeth or tooth. So slowly that start to erode our first layer of dentin. So this is the overall process of how dental caries occur. So that immediately after taking food or any hot tea or juice or like anything after eating, so we should gargle immediately with 1 or 2 times, so that if any food particles present between the teeth, that will help you to come out from the mouth, then you feel very better. And also it will prevent the bad odor comes from the mouth also. So this is the main precaution. So how to get rid from the dental caries. And next one, name two inorganic fluoride compounds used in dental product, like sodium fluoride and stannous fluoride. So next, I think these simple or want to One word answer will give you to understand the overall concept about dental product. Very short answer. And next we'll see what are the expectation of questions from the dental product. Long answer like explain in detail about dental hygiene. Now also I discussing about dental hygiene. Next, write a short note on anti-caries agent. So here you should write about the anti-cariogenic agent like rolla fluoride and rolla phosphate. Like rolla fluoride is stannous fluoride and sodium fluoride, and you should write about brief discussion about rolla fluoride, like how do you prepare sodium fluoride and what is the uses, method of preparation, description and synonym if it has, and molecular weight, and also what is the molecular formula. So as like monograph which we already studied from history of pharmacopoeia, like these are the monograph pattern you should follow like in this basis. And also you have to discuss about the stannous fluoride at the same time, as well as on phosphate, roll of phosphate here used as a cleansing purpose. So like sodium monohydrogen and sodium dihydrogen phosphate, these are the two pharmaceutical inorganic substance, phosphate in the form of that also you should describe about deep manner. So these are the short note on anti-caries agent. Next, the same question again, describe the role of fluoride as anti-caries agent. The same you have to again you have to describe about role of fluoride. Next we'll see about give the method of preparation and properties of uses of sodium fluoride. So you may go through once again method of preparation, like the same thing like stannous chloride also. Then give a brief account on the cleaning agent or dentifrices. Then what is the difference between dentifrices and desensitizer? Dentifrices only which will clean the teeth with the help of there are two formulation, tooth powder or toothpaste, which plays a role to clean our teeth properly, but desensitizer which will decrease the hypersensitivity from the teeth. So these are here the dentifrices cleaning purpose, desensitizer decrease the hypersensitivity of the teeth. Next, explain in detail about the method of preparation, properties and calcium carbonate. This already I discussed with the second session. You may go through from there. Next, explain in detail about the method of preparation and properties of sodium metaphosphate. These also we already discussed in the previous session. And this last question also we described from the previous session. Now we'll see about fill-ups. So dentifrices are the compounds that are used for cleaning teeth and gums. So dentifrices are the compounds that are used for cleaning teeth and gums. Next question. The cleaning action of dentifrices depends on their abrasive. Cleaning actions of dentifrices depends on their abrasives. Next, to prevent dental caries, toothpaste containing sodium chloride should be used. Why? Because that sodium chloride act as, that means preventive from dental caries. So that to prevent dental caries, the toothpaste containing sodium fluoride should be used. Next, the soluble salt of phosphate, or two types of phosphates are there: sodium monohydrogen and sodium dihydrogen phosphates. Next, dash is the medical term for the tooth decay or cavity. Nothing but dental caries is a medical term for tooth decay or cavities. Next, concentration of fluoride in drinking water is 1.5 to 3 ppm. ppm is nothing but parts per million. Next, stannous fluoride is prepared by heating with, now this session we already discussed How do you prepare stannous fluoride when heating with stannous oxide and hydrofluoric acid? So, in the absence of oxygen. Next, chemical formula for sodium fluoride, that is NaF, and stannous fluoride SnFN2. SnFN2 is the formula, chemical formula for sodium fluoride NaF, and stannous fluoride. Stannous means Sn and fluoride F2. Next, dash to reduce the sensitivity of teeth to heat and cold. So here sensitivity of teeth and cold, desensitizer reduce the sensitivity of teeth to heat and cold. Next, precipitated chalk is nothing but is the synonym of calcium carbonate. Precipitated chalk is nothing but synonym for the calcium CaCO3. Next, multiple choice question also will discuss once again, so that which will give you much more idea about dental product. So fluoride inhibits caries formation via downward acid solubility of enamel and bacterial inhibition. So fluoride inhibits, that means downward means which will decrease the acid solubility of enamel. I already told you how the caries formation on the teeth occurs on the teeth or tooth. So that here the fluoride which plays a two role, like it will downward or which will decrease the acid solubility of enamel, and also to in some of the bacteria to be present on the teeth. That bacteria is responsible to secrete the acid secretion. So this acid slowly which will erodes our teeth, so that we will have tooth decay or tooth cavities. So here if we have in the toothpaste or tooth floor powder which has fluoride which contains, which will decrease the acid solubility of enamel, and as well as bacterial, which will prevent the bacteria present in the mouth also. So which will kill the bacteria present in the mouth. Next one, hydroxyapatite is a mixture of calcium salt of like calcium carbonate, all of these above. Next, dental caries is a medical term of what is that? Tooth decay or cavities. Next, fluoride can be administered either by both topically and orally, that I already told you. We can take as in that oral formation, or by apply on the teeth itself also we can reduce the pain. Fluoride. Next, sodium metaphosphate is also known as mineral salt. That is a synonym of sodium metaphosphate. That precipitated chalk is nothing but synonym for the calcium carbonate. Next, desensitizer tend to downward the hypersensitivity. That means decrease the hypersensitivity of the teeth. Next, example of desensitizer, zinc chloride, sodium fluoride and stannous fluoride. That means always remember that sensitizer. Desensitizer means, so fluoride, you should remember that fluoride in the form of sodium fluoride and stannous fluoride. Next, butter of zinc is also known as zinc chloride, is the synonym for zinc chloride. Next, zinc chloride and strontium chloride is nothing but used as a abrasive nature. Abrasive, to act as a abrasive. Abrasive is nothing but also cleaning and polishing, but it is not recommended for self-medication. The doctor, that means dentist, will prescribe you to take for zinc chloride or strontium chloride as a abrasive purpose. Next, which vitamin? There are 3 vitamins. In the previous section we already discussed. A, C, D is necessary for the tooth formation. Next, phosphate is used as a cleansing agent like 2-phosphate sodium monohydrogen and sodium dihydrogen phosphate is the 2-phosphate roller phosphate is used for the cleansing agent. So I think this overall discussion about fumes and desensitizer, what is the role of desensitizer and how the fume is to be prepared from volcanic origin and why is it important fume stone is to be used as a active ingredient in a dental product means it has lot of silicates in the form of aluminum, sodium and aluminum, sodium and so aluminum, potassium and sodium so that it is to be used from the volcanic origin. And also we discussed about overall desensitizer and what are the main pharmaceutical inorganic substance used for like strontium chloride and zinc chloride to be used as a desensitizer. And we'll discuss about long answer and short answer and objective also. That I think this class which will help you about much more understanding about dental product. Thank you.